I'm a real doctor. Let's figure out together what's going on here. You may be watching this and asking, why didn't he get this taken care of before it got really bad? Well, in China, 95% of their citizens get basic health care covered by the government. But that's basic health care, and in order to prevent a condition like this with ankylosing spondylitis, you probably need a lot more than that. For specialty surgery, you typically need to have private insurance that you have to pay for out of pocket. That, or you can pay for the surgery up front and then get the procedure done. Now, there are a lot of people who are against nationalized health care, but in situations like his, obviously that would have helped him. And what would have happened if he grew up here in the United States? Who knows? Ankylosing spondylitis is an inflammatory autoimmune condition where essentially your body attacks your own joints. Now, this primarily affects the spine, and this can cause a reduction in movement, it can cause a lot of stiffness, and it can cause chronic pain. Now, it can also affect the sacroiliac joint, and this is the area of the pelvis that connects basically the pelvic girdle to your spine. Now, in general, the movement of our body is centered around that area. And so if your body is attacking the joints in that area, then that can result in significant stiffness and eventually progressing to his situation.
听到哪个地方讲得好，就带他去治，都没有效。 So
when somebody is diagnosed with ankylosing spondylitis, one of the first things that you can do to help slow down the progression of this disease is physical therapy. In general, physical therapy can improve symptoms and can help slow down or even prevent ankylosing spondylitis from worsening. But unfortunately, there is no cure for ankylosing spondylitis. You are essentially trying to slow the condition down, hopefully even stop it, or treat the symptoms of it. Another common early treatment are NSAIDs, and these are non-steroidal anti-inflammatories like Motrin or Naproxen. These NSAIDs can be used to help with pain and inflammation when the condition isn't so severe. So how did it get so bad? Well, before it gets this bad, once again, physical therapy and NSAIDs are often used to try to help slow down the progression of the disease. Steroids can be used to help tamp down the body's autoimmune response to these joints, but the problem with steroids is they can have a lot of side effects, especially if used long term. And there are other medications called disease-modifying anti-rheumatic drugs that can be used to help slow the progression of this disease as well. Now, I have to assume that he probably got very few of these various treatments that I've talked about.
Li Hua 的病叫强直性脊柱炎后突畸形，脊柱畸形变成重度就会压迫心肺，造成心肺功能，或者压迫到脊髓，造成病人的截瘫。
Now, I've never seen or heard of this condition this severe before, but there are certain celebrities who have been very open with the fact that they have been diagnosed with ankylosing spondylitis. Dan Reynolds, the lead singer of Imagine Dragons, has been diagnosed with ankylosing spondylitis, and he's been very open about how it has affected his life. The guitarist from Motley Crue, Mick Mars, has also been diagnosed with ankylosing spondylitis, and he has been very open with just the horrible effect that it has had on his health. In fact, this is a direct quote from Mick Mars. Take a 40-pound cinder block and attach it to a chain around your head and walk around with it. That's what it feels like to have AS. A surgery of this type would have to include many different types of physicians. First would be an orthopedic surgeon, and then a neurosurgeon who specializes in spine surgery, and postoperatively you would need a physical medicine and rehabilitation doctor to help the patient get through the rehab process and to strengthen his muscles.
第一步手术呢是要做无骨镜的截骨，让他的腿离开嘴巴一部分，为2次手术做准备。
It appears that his condition has caused his femurs, and these are the large bones that comprise the upper leg, to either deform or to be too short. Now, an osteotomy is a fracture that you make through a bone using a saw, and bone grafts can be used to essentially have that bone heal in a different way as it was before, whether it's longer or maybe in a different direction. These bones can be taken from other bones of the body, like let's say the hip, but probably in his situation, my guess is that they used a bone graft from a donor. Now, while the thigh bone surgery was definitely risky, this operation is a lot riskier. If you are fracturing the bones of the cervical spine, you're fracturing the bones of the neck, then you can potentially damage the spinal cord. If the spinal cord is damaged, worst case scenario, he could become a quadriplegic. And this is a person who has no voluntary movement in their arms or their legs. Have you tried my exclusive skincare line, Youn Beauty? Our products combine natural and organic ingredients with the latest and scientifically proven anti-aging components like vitamin C, retinol, and peptides. If you're looking for healthy and youthful skin without the unnecessary chemicals, fragrances, and additives, then this is the skincare line for you. I'm so convinced that you will absolutely love my skincare products that I've instituted a 30-day money-back guarantee. Check them out at younbeauty.com and enter the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Oh wow, that is amazing. So what is that contraption attached to his head? Well, this is called a halo, and this is a device that stabilizes the head after spinal surgery. Now, kids actually wear halos very similar to what he's wearing after they undergo scoliosis surgery, and there are a lot of videos online that have gone viral of kids with these halos on. Take a look at this video that explains it much better than I can.
This is how doctors fix severe scoliosis. They turn to a technique known as halo gravity traction. This involves attaching a metal ring, called a halo, to the patient's head using small screws. These screws anchor the halo to the outer layer of the skull. The ring is then connected to a pulley system that applies gentle, continuous tension to help gradually realign the spine. Initially, patients may experience mild headaches, though these typically subside with time. Throughout the process, medical professionals closely monitor progress through X-rays to ensure proper adjustments. After 4 to 6 weeks, the spine often shows significant improvement.
Now, this is another big operation, and the main risk of this operation is going to be paraplegia. I mentioned quadriplegia before, and that's where you have no movement, voluntary movement in your arms and legs. Paraplegia is no voluntary movement in your legs only. And if that's caused by the actual surgery, then we call it iatrogenic paraplegia.
手术不是新手术，但是组合起来，这是一个全新的系统的工程。我们需要麻醉科、脊柱外科、关节外科、感染科。这个手术是一个多学科合作的手术。
As a private practice plastic surgeon, I most of the time will operate on my own, but there are times where I work with other surgeons for the benefit of the patient. So for example, if I do tummy tucks, sometimes I'll work with a general surgeon to, let's say, repair a hernia at the same time as a tummy tuck. Or I may work with a gynecologist to, let's say, do a hysterectomy during that tummy tuck operation as well. Now, there are some plastic surgeons who work with oncologic breast surgeons, where the breast surgeon will perform a mastectomy for breast cancer, and the plastic surgeon will then reconstruct the breast. And we even work with orthopedic surgeons. If, for example, the orthopedic surgeon has a patient who had a traumatic injury to the lower leg, we call it a tib-fib fracture, sometimes they'll need plastic surgeons to come in to actually help heal that open wound by putting muscle over that area.
蛮难的一件事儿。 它骨质疏松的特别厉害，钉子打到这个骨头上，一拔就拔出来了。内部钉如果拔出来了，那也一样会有。
Osteoporosis is a condition where the bones become more porous and less dense. Essentially, they're not as thick or strong as they used to be, and they can then be more prone to breaking. Now, this can have multiple causes, such as advanced age, hormones, and even the diet. In his case, lack of activity because of his obvious condition also probably contributed to his severe osteoporosis. And this is one reason why it's so important as you get older to do resistance training, to essentially lift weights, because that's going to help prevent your body from having osteoporotic bones. This can help prevent fractures later on in life. Well, this is absolutely incredible. Now, 10 hours is a long time to operate on someone. The longest I ever participated in an operation was probably closer to 14 hours, and this was way back in residency. In my practice, I try not to operate more than about 5 to 5.5 hours on a single patient because of the potential risk of anesthesia-related complications, blood clots, and more. So a lot of people ask, what do you do during an operation that long if you have to go to the bathroom? Well, the answer is you hold it.
Huh?
Well, not really. You try to hold it for as long as you can, but eventually you do have to use a restroom. Then you go use a restroom, you grab a drink of water. If you have a few minutes, maybe you throw down a protein bar if you can, but otherwise you get right back in the OR and try to get that patient done and off the operating room table as efficiently as possible.
其实看到新为了给我治病，比以前老了很多了，头发也白掉了，感到日子过意不去。
他也不能一辈子照顾我了，所以想把这个病早点治好了，早点减轻他的负担了。
Can you imagine how the world is all of a sudden totally opened for him? I mean, it's amazing when you think about it. For all your life, all you can actually see are your thighs all your life, and then now you can actually look out a window, you can see the sky, you can see birds in the trees. I mean, it is an amazing thought and so much of what we really honestly take for granted. Well, what a great story. Now, I know you're probably wondering an update on his condition, and last I heard just a few months ago, he's doing very well, and he's actually working in his family's store. So he was dealing with being folded over for all of his life, but what about a person who is dealing with a mass from the back that literally looks like it's a cape? Yes, you've got to take a peek at this woman dealing with these masses literally hanging from the back of her neck that look like they are a cape. How do you get rid of them? Take a peek at this video right up here. And as always, remember to adopt, don't shop, save a life today.